Hey, welcome to another Right Brain Recess. I'm Dr. Laura Salyer, and this is where you learn tips and tricks to unleash creativity in your medical practice so you can have more fun and less stress. And today we're going to talk about a one-sheet tool that you can use that can save months, maybe even years, from frustrating office visits. It's inspired by this story, and this is a true story. I just got off the phone with a prospective and curious patient looking to come into my functional medicine micro practice. And for those that didn't know my start, I was an employed family physician in a regular employment model, but I exited this after years of burnout and recreated my ideal way of practicing medicine in a functional micro practice after getting certification through IFM. So a lot of my conventional colleagues would say, well, that's easy. You get to pick all the people you want to work with now. You'll never get burned out. And that's true. I do get to vet every patient that walks in my door. I get to invite them into my membership if they meet criteria, but burnout can happen even in a functional and holistic model. But this one sheet, I really believe, will be a key feature that can help save frustration. So this person was asking in this discovery call about my policies and my price points and testing, and normally that's okay, but the problem is that's already answered in several email sequences before they get to that phone call. In fact, it's on my website, clearly stated. There's even courses that they can take for free that talk about how to get the most out of your functional medicine experience. I really want my patients to feel like students in the best university ever, which is of themselves. I want them to learn how they can get the most out of this. So when she was asking questions that were clearly within this content, that was a great point for me to ask, maybe I didn't make it clear, and maybe I could make this more obvious for a new person. So after I answered her questions, I asked her if I could ask where she thought she could find this information. And it turns out she did get all the information in the emails and on the website, but she didn't have time to look or read. She didn't have time to watch the videos. She just was rushing through to look for this appointment. So that tells me a couple things. It's a little bit of a cognitive bias as well. She also had some other things that she had mentioned, like she didn't really have time to learn new habits of eating. She didn't have time to stop and learn new ways of moving, etc. But it all points to the same thing, the readiness for change. Prochaska. Trans-theoretical model of change. Now, we may brush over it in medical school, but this is a workhorse in the health coaching field. And I would say medical schools would benefit from incorporating a little more coachy skills because, yes, we are the strategists that overlook the land and we know the future if you don't ever treat your high blood pressure or don't take care of your inactivity and sedentary lifestyle. We know the end result, and our job is to help patients try and get treatment. We sew up lacerations, etc. But when you're dealing with chronic medical conditions, medical schools really don't have anything other than motivational interviewing. And really, if we dial into this and normalize that wheel of change, we can help ourselves and our patients from having this power dynamic of frustration, because oftentimes physicians feel like they're working harder than their patient, and patients are feeling left that they're unheard and unseen. And what we can do is print this out, and I'll tell you how you can do that at the end of this little episode. But I have a whole infographic that is colorful and explains this whole wheel of change. When we normalize this, we'll see everybody has this going on in their life in various moments. So let's explain. Prochaska states that when we're wanting to make change, we go through all these stages first before we make those changes. The first is pre-contemplation. You're not even aware there's a problem. So let's take an example like smoking. Pre-contemplation would say that you're not even aware smoking is impacting your health because you don't walk upstairs or run a half marathon. You don't know how much your lungs are hurting. You have lost your sense of smell, so you don't know how much it stinks. So you're just not even aware of this as a problem. And then something will move you towards contemplation. Maybe you had somebody tell you that every time you walk into a room, they could smell the stench of cigarette smoke. And then that made you think, I wonder what kind of barriers would I have to changing that? But you're still really not ready. You enjoy the nicotine. There's too many other benefits as opposed to risks. Eventually, you'll move into that third stage, which is preparation. Maybe you had a friend that had a heart attack and he was a long-term smoker. Or somebody else you knew had lung cancer. Something changed where it changed your mindset enough that now you're in the preparation stage and you're learning more. You're more aware. Your brain is more cognizant of articles from the American Heart Society and facts about smoking. And so you're really taking all this information in. And eventually you'll move to the action stage where you're ready. You've set a quit date, you have your support system in place, and you're ready to go. And then hopefully maintenance, where this habit feels pretty good. You're existing as a non-smoker. You've regained your smell. Your lungs are more elastic. And you're feeling like might be the new you. However, what I love about Prochaska is he also built in another stage called relapse. Because it's human nature, we relapse. And then you just circle back around again and you do the pre-contemplation, contemplation, preparation, action, maintenance. Eventually, however many cycles it takes, it may become permanent. But the key is if we normalize this as part of human existence on Earth, then we take the judgment out. Insurance companies, mandates are all judging a care provider, a physician, a nurse, on how well their patient does, as to how good their care is. And that has caused this dynamic of almost codependency where physicians are really trying to push things in an agenda and then the patients aren't doing it. And it's not just normalizing that they might not be ready. And sometimes if you just put that sheet in front of them and say, point to where you are right now. Let's say they came in for their Lipitor refill, but they're not ready to make any changes, that they have extra 100 pounds they're carrying and they're still eating fast food. Allowing them to find themselves on this wheel of change and seeing that, this is a normal part of human existence. We all are on different areas of Prochaska in different parts of our life. Maybe you want to take up guitar and you haven't even made your first appointment with a teacher yet. Or maybe you want to create a walking habit at noon, but you haven't even put your shoes on. So we all have ways that we're trying to make some changes or not. But looking at this as a system and allowing the patient to self-identify and say, yeah, I guess I am kind of in this one right here. I really don't want to make any changes now. That's fine. Next time, maybe we'll see if we can move you up a bit. And having this visibility and transparency will ease the burden of fixing it for the physician and healthcare provider. And maybe it will help lessen that frustration and decrease burnout, because burnout can happen in all areas of medicine. And helping a patient heal has to be a collaborative effort between the practitioner and the patient, co-creating what future that patient wants. And sometimes the reality needs to come first. So identifying where they are on this Prochaska wheel of change might be the best healing salve that you could give them at that office visit. Awareness is curative. So if you'd like to have this colorful handout, please head to Facebook. I have a Creative Medical Professionals Facebook group. It is awesome. It's private, and you just have a small registration form to fill out, and then you can download and print this PDF graphic that shows in a colorful way all the different stages of the readiness for change. And then you'll have less frustration in your office visits. Thanks for coloring outside the lines with me, and have a beautiful day.